Guys, it's finally happening. I'm finally releasing and publishing this episode. I recorded this with my beautiful guest, Dr. Sande Bargeron, the end of July or beginning of August. It was then. It was when kind of all hell broke loose a little bit in my life. And getting back up onto the podcasting horse has been nothing but a battle and a fight. You guys, our conversation kind of blew me away. I think we broke some barriers. I think we broke a couple of things in the heavenlies. I don't know, which released a challenge over my life. And it's taken me months to figure out how to get this episode released. We talk about holistic health. We talk about conventional health. Dr. Sande has about 20 years experience in conventional and holistic. She's a Lyme specialist. She is a breast implant illness specialist. She is an anesthetist. She's in the muck. She's a mama of 5, a homeschool mama of 5. How she does it all, I really don't know. She's brilliant. She's wonderful. This conversation, honestly, I could have talked to her for hours. She's fascinating, absolutely fascinating. And I hope that you were blessed, that you were encouraged. Welcome, my friend, Dr. Sande Bargeron. Thank you so much for joining me today. And I would love to get to know you better. If you could share with me a little bit of your story, who you are, where you came from, and how you chose to do what you're doing today. That's a lot.
It's a loaded question. It's like this winding path.
If it's straight, I would be concerned about you, like something's not right.
Yeah, winding path as it is for all people on this planet. We expect to go one way and we end up another, right?
Seriously. My goodness.
Well, my name is Dr. Sande Bargeron. I am a PhD, not an MD, but I do have medical degrees. So I just kind of distinguish that because I don't want anybody ever to say that I'm impersonating a medical doctor. I'm not. I'm a PA. I do practice medicine, but I didn't go the direction of medical school, even though when I was 7 years old, first thing I wanted for Christmas was a microscope because I was going to be a doctor someday.
Nice.
But I also wanted to be a mama. And I decided that I would be a mama, and PA school would balance my work life and give me the opportunity to be a mama better than being married to a medical degree, and also taking on the debt of a medical degree is like $500,000 back when I was trying to go to school. I ended up spending the same amount of money, by the way, going to school. But I broke it up in pieces, so it was a little easier. But I ended up, I went to PA school and graduated in 2004, so I've been practicing as a PA for a long time and still have my certification. But it wasn't very long into practice that I kind of got disillusioned with medicine, because when I went in, I had this fairy tale that I thought medicine was the only way that you can heal people, and that it would look like. Actually, in my first quarter of PA school, there was this class I did. It was physical assessment. Essentially, they just taught you how to examine a patient head to toe everywhere. I mean, we've had models for GYN exams. I mean, we really learned head to toe examination. And in that process, there was a textbook with it. And of course, if we examined the eyes, there were all kinds of abnormalities we would see in the eyes, and it would indicate okay, well, that's a copper deficiency. That might be a this deficient. That, there's a lot you can see from the eyes and from the teeth and the nails. And so I was like, this is amazing. I can't wait to see what diagnosis looks like, because I thought, based on that, this is what we're going to be doing. I mean, I was only 21 or 2 when I went to school. I mean, I was really young when I went to school. So, I mean, I thought that's what it was. Prior to that, by the way, I was a certified fitness trainer all through PA school. I worked as a trainer to kind of help pay the bills. I was married with a baby on PA school, like 21, 22. And so anyway, I went through PA school, graduated, and was like, by the end of the first year, I was like, all I'm doing is prescribing anti-inflammatory medications or surgery. I did orthopedic surgery, spine and joints. You either did surgery or you gave them an anti-inflammatory. And if you gave them an anti-inflammatory, do you kill the kidneys or punch a hole in their gut? Because that's always a side effect. And I was like, this is not cool, because I'd have to tell them, older patients who have arthritis, I'm giving you this, but be careful with food, because you can get an ulcer, and just pay attention to how you're feeling, because also if your kidneys start acting crazy, that's probably from this medication, and I just there's got to be something else. And so I got pretty disillusioned with that over time, and so I was like, what am I going to do? I didn't know about natural medicine or natural medicine school like Bastyr or anything like that. So I was like, well, should I go back to medical school? Because I hate this.
It
But
was
if I
that
go back to
bad,
medical school, what's that going to do?
right?
I just didn't know. But I did work in the OR, and I was introduced to a profession I didn't know existed. I thought anesthesia was all anesthesiologists, but it's actually most places are anesthesia care team models. So that means that you have an anesthesiologist readily available who oversees 3 to 4 rooms, usually 4, and there's anesthetists in the rooms, and they deliver the anesthesia, and they're there with you the whole time. And they're very well trained. We were very well trained. It's harder to get into anesthesia school for us than it is to get into medical school. It's a very challenging program. And honestly, between the 2 programs I went to, anesthesia school was really hard. Very hard.
Really?
Harder than PA school. I decided that, look, these people have a better work-life balance, and the drugs they give, at least I can see a reason for giving them. If we're going to give drugs, these are short-term drugs. They accomplish the goal. They don't go home on them. Like, this isn't like altering their life. In fact, it's probably helping. I know it's helping because who wants to have surgery awake? Like,
Right?
so I went into anesthesia school, and it was another 2.5 years. So ultimately, medical school's 4. I did 5.
Oh my goodness. So, okay, so there's a difference between an anesthesiologist and an
Anesthetist.
anesthetist. Okay,
Anesthetist.
and
And
you're
the
an anesthetist.
anesthetists are grouped into 2 categories. Most people know nurse anesthetist.
Okay.
That sounds like most if I say anesthetist, they're like, "Oh, like a nurse anesthetist." I'm like, "Yeah, kinda, but I'm not a nurse."
Okay.
So a nurse anesthetist goes the nursing route. I have to go through nursing school at ICU and then go to nurse
Okay.
anesthetist school. And anesthesiologist assistant, an AA, is an anesthetist. We
Okay.
do the same job. We function the same way. We're
It's just a
trained
different
very
path.
similar. Our clinical skills are the same, but we're not nurses. So
Okay.
and you can have a different degree, like you can have an undergrad in biology and go into anesthesia school that way. I just
Mm,
happen to be a PA. So I
okay.
just double boarded. And it did make some things easier in anesthesia school, like pharmacology. I already did it. So like, I think I blew the curve because I didn't mean to. It was just I'd seen it before and I already took these tests, so it was easier.
Sure.
But some things were harder. Physics. I hate physics, but there's a lot of physics in anesthesia. So anyway, we went through anesthesia school, and then in anesthesia school, so between anesthesia school and PA school, I had 2 kids. And then there
Oh
was a break,
my goodness.
anesthesia school, and there are a lot of rotations in anesthesia school. I had my 2 babies, and I got pregnant the last 2 months of anesthesia school with my 3rd child. And so I had him right after I graduated, about 8, 9 months later, which is always nice being a new employee coming to a place and saying, "So I'm
Surprise.
pregnant." So that was fun. But I went straight into working in a level 1 trauma center. That's still where I work, in a level 1 trauma center still today. Um, which is a really good experience. The one I worked in at the time, we did it all. I mean, we did newborn babies to, old folks. We did open heart surgery. I've
Okay.
seen it all except doing the retransplant of transplants. We harvest organs. We do
Okay.
all of it. So it was a good experience, but it's a very taxing job. In last time I checked, about a couple of years ago, anesthetist stress level is like an anesthetist, CRNA, not anesthesiologists. Those were they were down lower, believe it or not.
Oh, wow.
Anesthetists were second only to air traffic controllers in the level of stress. So it's a very stressful job, and it's because people die in front of you often, especially in a level 1 trauma center. You can't save
Okay.
everyone, and so it's not. And then it's toxic in the sense of toxins, not
Right.
people. Toxic work environment. It can be very stressful too with people because people are trying to save lives, and so they're not like going to be holding your hand and cuddling you.
They're not
They're
in
going to
their
be,
happiest best
you know.
self.
So you have to have kind of a personality that handles interpersonal
Intensity.
intensity. Yeah. And so I did that after anesthesia school. During that whole time, I had health issues my whole life. Like I grew up in sort of, I would say, a Christian family. My
Okay.
mom is a Christian. My dad was raised a Christian, but I would say he's not necessarily. I think he's a legalist, and he wouldn't call himself a Christian because he
Okay.
doesn't want to be labeled. So that says a lot. Yeah, yeah. But he can't. deny the truth of Christianity. He's one of those people who sits on he's like, yep, that's true. It's true. It's true. But there's no surrender. So it was a very stressful home environment growing up. And then I dealt with some sexual abuse as a child. That this is part of the story much later on that I didn't really know what to do with as a kid, and neither did my parents. So that was part of the story. And then in that time, and it's probably one of the triggers of my autoimmunity was that childhood experience, was I had developed a psoriasis, which was an autoimmune problem. So by the time I had my third child, I had, gone through 2 schools, gotten married, had 3 children, and, worked in a high stress job second only to air traffic control. So by the time I had the third child, my psoriasis was out of control, and the topical meds that I've been taking for 20 years didn't work anymore. And I was like, well, I haven't looked at dermatology since I went to PA school in the first place. Like, surely they've come up with some more advanced
Cutting
stuff,
edge.
I think, so there's certainly something for it now. I go to the dermatologist, I pay the $70 copay, like insane because they're so expensive. And literally I was annoyed because I'm a PA and I'm a smart PA. I'm like, I like to study. I like research, and I keep up to date on the research. I know it's out there on medicine. I looked it up and I already kind of got an idea that there wasn't much, but I was hoping that they had some secret knowledge that I didn't, because they're in the
Absolutely.
profession,
There's always
right?
that hope. Like
Yeah,
this is their niche. This is their thing. They
there's
should have
something.
some insight into like the latest and greatest, technology.
Yeah. And I sat across from the PA, and he was like, yeah, so we can give you, some, these biologic medicines, sort of like methotrexate, immune suppressing parts of your immune system. And I really knew I didn't want those because they're linked down the road to certain types of cancers. Because what do you think happens when you suppress part of your immune system? It's not exactly, it's like creating a targeted version of HIV. I mean, like, why would I do that? And I didn't want to do that. So I was like, okay, yeah, not going to do that. Plus, I'm nursing. I can't take these drugs. And they were like, yeah, you can't take those drugs. I guess I'm living with this. So, and when I say my psoriasis is bad, I can't express how bad it was. It was so bad. It was all through my scalp, inside my ears, around the back of my neck, down across. It spared everything. It hit everything and spared my nipples. Okay, sorry if I can't say that on
No,
the
that's fine. I've been
in my armpits, in my groin. It was so painful. I felt like a leper, like hiding it and putting oils on. Nothing works, And besides the fact that it was disfiguring, it was just painful. It was uncomfortable. So that one of my friends who was a homeschool mom, I'm a homeschool mom. We were homeschooling our kids at the time. And she's like, I have some essential oils.
Oh,
And I
yes,
was like,
the good old
oh,
EO
aren't you
cures, right?
cute? Aren't you sweet? Don't you? I mean, and this is Lord humbling me, right? He's like, hey, she's offering these oils, and I'm like, girl, please. I got 2 degrees, like 2 medical degrees, and you're gonna offer me some essential oils,
Right.
like,
That's kind
right?
of woo. That's yeah.
But she was loving and kind enough about, my pride. She wasn't. She should have confronted my pride, but as a Christian, But this was
She was
ultimately, it was
gentle.
pride. She was kind, and ultimately I was like, I'll buy some essential oils. I don't care. They'll smell good at least. Like, I didn't think anything about it. I just was going to support her and buy some oils. And I bought them, and she was. I don't know if it was the Holy Spirit or she was just really smart, but she gave me a book that had some education about them in there. And at the time, now you don't quite get this kind of information about essential oils because of FDA oversight, but they had like scientific data. They had explanation of how they worked really, really clearly. And what was interesting is that piece in that book that explained how they worked internally through inhalation. It read like some of my anesthesia books. And I was
Yep.
like,
Good
well,
old
that's what
chemistry.
put the mask on the baby and he falls asleep. Well, how does that work? There, because I'm inhaling it, So I'm like, well, that kind of makes sense. Okay, I can see that. I'm not discarding it now. You've got some science. I trust the science. And so I was like, oh yeah, I'll try them out. Whatever. It's not gonna hurt, And so I was looking up how to, topical things for skin issues, and I tried some oils on them, and my plaques went away. And I was like, hold up. What just happened? What just happened? And what are these things and why? And what else don't I know? Like, I have literally spent $500,000 on my education by now. And I don't know that these little plant things that somebody in MLM is telling me works. Like, what? So basically I call essential oils my gateway drug. into holistic health, because then it was like, I got to understand all of this.
All of
And
this.
so,
It's amazing when something, just the door cracks open and it totally blows your world. And then all of a sudden you find yourself questioning everything and looking at everything through a completely different lens.
yeah.
I did that anyway. I don't know.
Yeah.
Yeah.
So I basically dove in head first into like understanding gut health was something new to me. Like I know that's because I was like getting topical relief, but they come back, So I was like, there's this thing about gut health. What do I need to know about gut health? And so I went to the medical literature because I'm used to studying looking at double blind, placebo control, blah, 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 blah. I was taught that. And so believe it or not, this was in 2011 or 12, no, 11-ish. There was actually medical studies, and they're still there, you can look them up, but that were done by gastroenterologists that showed the link between specific bacteria and certain diseases that were dated like into the 90s, early 90s. We're like talking about like they've known this stuff. It's not new. And I was like, wait a minute, but I do colonoscopy anesthesia all the time. Why aren't they talking about that? What's going on? And as a PA, I remember I did a rotation with a gastroenterologist because I was really interested in understanding the gut health, like how it impacts the body. What do we do? Because that's the number one complaint people often have is heartburn. So is there some magic there? No, there's really not. Pepsid, and Tums, and colonoscopy and EGD because it makes a lot of money to do those procedures. And so, essentially, it just kind of made me start questioning a little bit about what the training I had was. What else are they limiting the narrative on purpose, or did they just not know, or what the heck, and I had call it kind of an existential crisis because at this point I'd been in medicine for almost a decade. Like if you consider my training time, almost a decade. I was, and so I'd been taught certain things and now I'm questioning them and I don't want the whole domino to fall, but because I can't, if I lose confidence in the medical system, what am I supposed to do with myself? You know what I mean?
Right?
So it took me a decade after that to sort of bring it all together because I waffled between, I hate medicine. Okay, well, I see how God uses both. And that's where I am now. Like I see how God uses the wisdom of both. And I do. You cannot live as a Christian on this planet and believe that systems aren't broken the way our bodies are broken. So if you put all your hope in medicine or all your hope in functional medicine or all your hope in anything, you're being deceived because sin has infiltrated every aspect of creation, every system, because every system is made by humans and human hearts are broken.
Right. Absolutely.
And so, that kind of understanding came as the Lord started to work on my own heart and my own salvation process. Like I've been a Christian like my dad. I've been an apologetically, I can't dismiss Christianity Christian. That makes you a legalist who follows rules and needs perfectionism. So that was all me until my son's health started to decline. This is the one that was born right after anesthesia school. So I call God very kind and merciful to have given me my own health issues where I had to challenge what I understood as my dogma and give me different tools and give me time to do the research because it took me about 5 years before he really got sick, 5 or 6 years. He developed Lyme disease. And if you know anything about chronic Lyme, most people at this point know that it's horribly debilitating.
He was 5?
He was 5 when he had his first symptoms. And ironically, they were unmasked during anesthesia. So he had ADHD symptoms. My oldest, very, very ADHD and had been down the whole. I mean, I was a PA when he was in school. I was PA school. So the kid got everything. He got all the vaccines, all the medications, I think he had antibiotics 3 times when he was a year old. He was on a nebulizer because he had asthma. He was on inhaled steroid. And then, of course, at 4.5, almost 5. No, he was 5. He was finally 5. But he was 5 when I put him on an Adderall type medication. So this poor kid is medicated. And I saw how horrible that was. Kid couldn't gain weight, couldn't grow, just not good drug. I don't recommend it. And so here was my 3rd child who was like manifesting ADHD symptoms. And I was like, oh, no, we're not. No, not doing that again. So gut health, we worked on that. We were already doing those things. They weren't quite enough. The oils weren't quite enough. And I was like, what am I missing here? And so I stumbled on to the Feingold method, which a lot of people may in the homeschool community might be familiar with. But Feingold was an allergist
Mhm.
by from Kaiser, which is a big medical system, back in the 70s. He got demonized for his work, but he was an allergist who stumbled onto the connection between food and mental health. And essentially, he had a schizophrenic 18-year-old schizophrenic kid come to his office for allergies. Mom brought him for allergies. And they had done a lot of work, and he finally said, look, we need to kind of give a elimination diet for this kid, and we need to remove X, Y, and Z. These foods are kind of highly triggering, and I suspect that also these preservatives they've added to the foods are a part of the problem. So let's eliminate all that, and we'll see what comes back. The kid's all schizophrenia reversed. Like he became a normal kid. And if you don't know, schizophrenia, according to medicine, is not curable. So that was like, whoa. Okay, so I reversed this kid's schizophrenia with food. Okay, so maybe this epidemic of ADHD, because Adderall was being marketed at that time very heavily, as was Prozac. My husband, who was a child being raised in the 70s, I found his Adderall at his grandma's house in the attic.
No way.
From the 70s, yeah. I mean,
Oh.
the ads for it, they were just everywhere. And so
Prolific everywhere, yes.
so of course, here's Feingold saying, no, it's food. So of course he gets demonized. So we did that method with him. The organization's still a nonprofit and does some research, so you can find them on feingold.org. But we did that, and his ADHD went like he was like talk, busy, and all of a sudden he's sitting and he's coloring and he's like focused, and I was like, wow,
that must have been amazing to watch as a mom.
Amazing,
absolutely amazing, and relief. I can imagine the relief that you must have felt.
Oh yeah, it was. I think we had that experience over a summer, and when we came back to it because we did homeschooling with the classical conversations, and we'd meet once a week, and we'd have, you do presentations. I don't know if you're familiar with that, but their family does presentations, so the kids do presentations. And Stephen, my son, wanted to present the Feingold method because that's the kid he is. He's a smart one. He wants to explain everything. And so we presented it, and everybody's like, got questions?
Right?
And they're like, so how do you know it worked? And all my husband did was point at Stephen, who was in the back, just hanging out, just quietly. They all knew this is the kid that was spinning around the room and could not stay still the year before. And so here he is on the stage, sitting there quietly, listening. He said, my husband said, I heard a collective gasp. So, yeah, so there's this collective gasp about, there's this kid. But the thing that was interesting was now that his brain he could speak what he was feeling. And I could still see that it wasn't right because he had these dark circles under his eyes. He just didn't look right. He was thin. It didn't look healthy. And here we lived on a homestead. I mean, we had a big garden. We had chickens. We all the things. I mean, we're a cliche for homestead.
You're living the dream, girl.
And he's still not looking great. And so I'm like, I don't understand. I found a picture of him. I couldn't believe how bad he looked. He looked so bad. He looked like a cancer patient. But he started to say, I don't feel good. My tummy hurts, these type of things. And around that time, he swallowed a coin, got lodged in his esophagus, had to go have surgery.
God bless our children.
It was a short anesthesia. He had surgery where I practiced anesthesia. I knew who was putting him to sleep. I knew the surgeon. I mean, I walked him to the OR, and it was literally, like a 10-minute procedure. But pediatric anesthesia is very interesting. It's all of the gases, so he came back and it was like, his health went kind of downhill. And, I can't say it was anesthesia. I was telling you already that he was sick beforehand, but anesthesia kind of was one of those events that
tipping point,
a toxic event that triggered now this decline. And it was like, he was too fatigued to go outside. His joint hurt all the time. And finally I was like, I got to go to a functional doctor. I don't know. So I took him. Of course, I wasn't practicing yet. This is now 2016-ish, 17, something like that. And they're like, he's got Lyme disease. He's got mold illness. He's got all these things. And I was just like blown away in the labs they did. I'd never seen labs like that before. And I was like, what is this? Why don't we do this in medicine? This tells us about the mitochondria. The mitochondria is everything.
Right?
So I was kind of blown away with my first experience there in functional medicine. And then, of course, he had Lyme. And the thing I would say about Lyme is that not everybody who knows and agrees that Lyme is a thing knows how to treat Lyme. So as much as I'm thankful for that practitioner, that doctor, he was an MD, meaning he went to medical school and then naturopathic school. So pretty smart guy. I would say probably smarter than me. Like, yeah, that's 8 years of school. I did 5, but he still didn't really understand the complexity of how you deal with Lyme. And so I couldn't quite get the dial moving on him. And because mold was an issue and at the time I lived in Georgia, everything we tried to do didn't work because we couldn't get it away from the mold. The mold was outside, it was inside, it was everywhere. And so then we moved to Colorado to get away from that. And that was during COVID. And I tried finding practitioners here, but I couldn't. And so I finally was like, I'm going to get my PhD in natural medicine. I'm going to figure this out on my own, and we're going to walk this path together. And that's what we did. And at the time, like, he would fall he couldn't make it across the floor from the couch to the bathroom without stumbling and falling. His nervous system was so wrecked. He could barely eat anything. He couldn't eat onions. He couldn't eat garlic. He couldn't eat tomatoes. He couldn't eat apples. He didn't eat anything. He had a really good diet. He ate salmon and asparagus all the time. He just was very limited. No gluten, no dairy, no eggs. Couldn't eat eggs. So by the time I took him through, it took a year and a half to treat him. And now he's 14 and he plays football and soccer and
He's thriving.
fencing. He's taller than me. I mean, the kid was failing to thrive. He was so thin. He gained weight so rapidly after he got well. It was crazy. But so that was my process of where I'm like, wow, this is really important. Like the order of how you handle dealing with Lyme being one of the most complex things that affects your detox pathways. It affects your nervous system, your immune system. Everything has to be dealt with all together at one time. That it was just really a complicated thing. And so then I was like, what do I do with this information? Like all these people, there's a lot of people that need this. And the time it was COVID, I had lots of people coming to me like, what do I do for COVID? What do I do for this? What do I do for that? And it was starting to be enough of an ask that I was like, I'm taking time away from my family to help these people. It really needs to be a job, a ministry, or something. But I mean, I work full time. I gotta at least justify that I'm away from my family for a reason. And so I had to do a lot of work to understand what was a safe way to, basically be a consultant. I'm not practicing medicine here. I can't practice medicine, virtually without very specific parameters. And I didn't want to practice medicine. This isn't medicine when you help people detox,
Right.
And so I had to navigate some things and set up my business. It took me a while, but there we are. And then 4 years later, we wrote a book together. Let's see.
The kids get Lyme disease too. I'm so excited. I bought mine. It's in the mail right now,
Okay.
on the Amazon truck. And I looked before I jumped on with you. There's only 4 copies left. So
oh wow. Well, that's amazing.
there's no copies left.
Oh my
Almost.
gosh, that's amazing.
People
it
get
tells
on
our
and
story.
it's on sale.
Yeah.
Oh, really?
It tells our story through that. I kind of just gave you the summary of. But the thing about Stephen is that the Lord is so kind. It's in Hebrews, it says our God was perfected in suffering. Christ was perfected in suffering. And then you go to us in chapter 2 of Hebrews, right? And then in chapter 4, he says, because we have this great high priest, Christ, who has passed through the heavens, the Son of God, who is familiar with our sufferings, who in every way was tempted as we were. That's in every way. Think about that, every way. We can therefore go before the throne of grace and seek mercy and help in time of need. In every way, Christ was tempted, yet without sin. He lived the life we couldn't and died the death we deserved. But he is familiar with the temptation to sin. And that's something I think people miss, and I think that it was a big thing for Stephen. He, at the time, it was beautiful and heartbreaking to me at the same time. The child, just all he wanted to do was sit in his bed sometimes and just listen to sermons. Like he just wanted to listen to sermons that were filling his soul. Like they were just filling his soul.
Coping mechanism.
8, 9, 10 years old.
Amazing.
Right. And I remember one day that he was very, very discouraged because it was a really hard day. We're in a phase of treating I can't remember if it was the systemic parasites or if we were treating the actual Borrelia, one of those two. It was really bad. It was really hard because it's physically painful when those things die in different parts of your body. And he he just felt he looked discouraged, where he's always had a good like attitude. Even while he was sick, he like, I can't walk, but I want to go. Like he was a good kid. He was just a sweet kid. And so because during this time, this is a piece I was going to bring back about, my childhood trauma. During that time, as if it wasn't hard enough to have a kid with Lyme disease, God decided that this was a good time for Sandra to deal with her heart.
Oh, he always picks the most perfect
Yeah.
times.
Yeah. When you have nothing in you, you have no
Right?
strength.
Your capacity's
Your capacity's maxed.
destroyed.
Yeah, God won't give you
Lord,
more than you can handle. Bull crap.
that's the biggest lie ever, isn't it?
Constantly give you more than he can handle. He's just the one that carries it.
Isn't that
Yeah.
wild?
And so like, it was then that I was confronted with the fact that I wasn't fine. I've been saying I was fine since I was 12 years old, after all that came to be. My abuse happened between like 6 to 10 years old. So I was fine. 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 Stop
Yeah,
asking me. I'm
covered in
fine.
psoriasis and pain, and you were fine.
Yeah. Right.
Oh, babe.
And so the
Aw.
thing about abuse, childhood abuse, is that as a child, there's this thing that you're not consciously choosing, especially if you're being raised in a home where God is a concept. If God isn't a concept, then when he's introduced, maybe I don't know what that process is. I was raised in a home where God was a concept that I was introduced to. The God that's supposed to be a loving God allowed me to have be abused, right? So you kind of reconcile that as in a child's mind. Remember, children don't have the developmental, abstract developments to process things well, and your brain isn't fully developed till you're 25 years old. So, I was already having kids by then.
Yeah.
I think what happened for me was that, and it's I would say it's not a uncommon thing. I think it's a very common thing, is that the shame that wasn't mine was mine. And anytime you said I was doing something wrong, that same yucky shame from the abuse, that's the same shame I felt when you told me I was doing something wrong. So naturally, I became a perfectionist. And naturally, I thought God was just dogmatic, exhaustingly rule giving. Like, I didn't like him.
Yeah. I wouldn't like that either.
Yeah.
Who likes that? Yeah.
Exactly. It was freedom. I think some people really understand the gospel of freedom. Freedom was not even a concept for the gospel for me at all. It was a lot of work. I always had to keep it up. I had to keep the image up. I had to keep it together. If I didn't keep it together, then I was failing, and then I was failing. I was feeling that shame. So, and so God was not a loving God who understood what I went through, cared about it, so around that time when Stephen went through his illness, here I am, and God is like, you aren't worshiping me. Who you've created as your God is not who I am. And through a series of different people confronting that in my life, which was very painful, I came to realize I had created a God of my own making. I mean, it wasn't who he said he was in his word, long suffering, close to the broken heart, like that. Oh. And so when I unpacked who God said he was, I had to repent a lot. And Holy Spirit is so kind, because you can't do that in your own strength. He gives you the ability to repent without dying.
Right.
You know what I mean? Especially when you think saying you're wrong is somehow associated with this nasty shame that you felt. Do you know what I mean? Like it was a miraculous thing. So he really brought me to life during that time. I would say like a true understanding of who he was, and made the gospel real. And I would say the gospel fell into our lives that time. And it was the time that I needed the gospel, right? So back to the story about Stephen and his discouraged day, going to biblical counseling with someone to deal directly with to take down every stronghold, right? To dismantle the lies I'd made about God in my head with someone. And she gives me 2 Corinthians 4, and I'll read it to you, because Stephen, I gave it to him during that day. It says, therefore we do not lose hope. Though our outer man, outwardly we are wasting away, yet inwardly we are being renewed day by day. For our light and momentary affliction is achieving for us an eternal glory that far outweighs them all. So we fix our eyes not on what is seen, but what is unseen, since what is seen is temporary, and what is unseen is eternal. And that's the verse I gave him. It said, God isn't saying, well, your affliction isn't real, and then it's horrible. Paul was in prison at the time when he wrote that.
He's very
He was
aware of it.
hungry,
Yeah.
cold, thirsty, tired, beaten, in prison, alone. He wasn't saying my suffering isn't anything. He was saying it's light and momentary. And when we compare it to the eternal weight of glory that we see when we are united with whom we were created for, And it was like I poured pure, I don't know, jet engine fuel in that kid because he was just like, well, okay. It's like childhood faith. You can't.
How?
It was beautiful. I wish I had
Incredible.
recorded it. He was like, you can just imagine the most despondent physical position and just this face of discouragement to joy, true joy that just emanated. And he was doing hippotherapy, like with horses, with it every Saturday, part of his therapy. And his trainer was not a believer. And so the next day he's like running over to her. He said, you know what God showed me in his word? You have to know this Bible verse. This is an amazing Bible verse. And he's telling her all about the Bible. So from the joy of the freedom of knowing that God was near, that this is temporary, that is eternal, that was enough hope to restore his bones, to make him preach.
Oh my goodness.
In his suffering.
And give him strength and joy. Wow.
Yeah.
It's incredible.
Yeah. So anyway, he wanted his book to have, he said, this is the part where I tell you about Jesus. And the first half tells the story of his Lyme disease. And the second half tells his walk with how the Lord comforted him in that. So it's a book that's really meant for all people. It's written as a child's book, but childlike knowledge is good for all ages, believe me. And so though I put the words on the paper, he approved every step of the way. And he was like, I want to tell him about Jesus. I'm like, okay. So that's all I was going to say about that.
That's such an incredible testimony and just an amazing reminder that as we do like really walk through hell sometimes in pain, like God sees it and man is in it with us. He's just in it with us. And for your son to see it at such a young age, that's such a gift. That's like
beautiful.
That's powerful.
It was convicting.
I mean, how can you not as a parent be affected by that?
Yeah.
And your faith challenged by that.
Oh, yeah.
Being a mom, man, I tell you what, it
the
will
hardest job.
hardest, but it will
anesthesia might be here, but parenting is probably it's the level above air traffic control. Parenting, air traffic control, or anesthesia.
Because it's just like, man, but it really does. I honestly don't know how parents do it without the Lord. I don't, because
you're giving all your flesh and
every aspect of my whole being in every way, it is, and it's good. It's not a bad thing, it's a good thing.
But we are not supposed to be that to our children, because if we are everything for them, then they don't need Christ.
No, I'm not everything, but they challenge everything in you as a person, as a parent. Like
they're lie detectors. They're like, you're not being genuine. I know you're lying. You may be saying something, but I can tell you lying. Yeah,
absolutely.
Yeah,
my goodness. And then they call you out on it too.
Oh yeah, yeah. Gosh, I mean, his Lyme disease was also a blessing for the rest of our family. So then I ended up working in holistic health, right? And I had 2 other children. Stephen's been the main character in the story here, but I have 5 children. So
5 children.
Yeah. So my oldest is 24 and my youngest is 9. And you remember, 24-year-old was in school with me in PA school. So he got the gamma. He's the one with all the meds and everything. And so his health took a massive dive at 18 when he said, I'm going to go eat whatever I want. And he went and ate Mexican and he ate out all the time. And oh my goodness, he lost his hair. He started gaining weight. Autoimmunity, like Crohn's disease, bad. Why? Probably because his toxic burden from early was really heavy. And now he's eating garbage. The second one, at the same time as Stephen was having his physical health challenges, the second one was having, I would say, a mental health crisis. He wasn't very old. He was like 8 or 9. And I remember, I am not Pentecostal. I was raised like Methodist, and at the time I wasn't even saved, so I didn't know anything. But I was like, something's not right. It's like this kid has a demon. It's like from one day to the next, he went from the sweet sort of loving, cuddly kid to oppositional, defiant to an nth degree that you couldn't. I was like, what is happening?
Yeah.
I promise I'm going to bring this back to your saying they challenge you on everything. But but we didn't know what was going on. We thought it was chemical, thought it was a form of ADHD. We actually took him to a pediatrician, tried some medication. That made things worse. He had all the side effects and didn't help. I prayed the demon out of him. I prayed over him. I'm like, wasn't much.
That's right, and that's a great one too. You don't need to go anywhere and get advice on that one.
I'm just going to do this. We got to pray together. I felt crazy because I'd never seen that, never went to a church that did that. But I was like, I don't know what else to do.
Right.
This is crazy. But we ended up learning to live with it and just walk on eggshells around the kid. It was unfortunate, but that's what we ended up doing because we didn't know what else it was. We didn't think it was something physical. We thought it was oppositional defiant disorder. And then as he went into his teenage years, now we've got a teenage rebellion on top of oppositional defiant. You can tell the kid anything. And homeschooling, when I tried to help be the parent, he was like, you can't tell me. And I was like, you're responsible for your education. I'm giving you the tools, but I'm not fighting every single day.
Yeah.
And it wasn't until after I did, worked with Steven and I got labs on my oldest child to show him why he needed to change his lifestyle, that child was like, hey, I want labs on myself. Now, you couldn't have made him do those because oppositional defiant.
He has to decide it himself.
He had to make every decision himself. And I found out he had pandas. And
we went through that with my daughter.
I tested him. He had strep and he had Lyme. So I suspect that around the time Steven got exposed, so did he. And I think I remember vaguely actually writing a prescription for an antibiotic for him around that time because of strep throat. I vaguely remember bits and pieces of that, but I wouldn't have connected those dots until I saw those labs. So then I was like, you have pandas. This has probably been part of how you've been feeling not like a normal kid. He'd say, I'm the autistic kid. That's what he called himself. I'm like, you're not autistic. I don't know what it is, but you're not autistic.
Right.
And he just kind of gave up, right? And now he had an answer. And so when I gave him that tool of knowing that was what it was, I was like, I can help you if you want me to.
If you have
yes.
to want it, yes.
That kid did every protocol exactly how I wrote it.
Are you serious?
And in 3 months, he was a different kid. 6 months later, he turned to his dad, who was the object of his attacks most of the time, because mom's the nurturing, loving mom, and the doctor, right? So, we can't attack mom.
Dad was the safe one to get his rage out on.
Raging on dad, and he's a boy, so he's raging on his dad, right? It's like a bad country song. So he turned to his dad one day, we live in Colorado, so blizzarded, and he couldn't drive his car, so my husband's driving to work. And on the way to work, my husband said, I almost slid off the road because he turned to his dad out of the blue. There was no conversation leading up to this. And he said, Dad, I just really want you to know I'm so sorry for how badly I treated you as a teenager. There was no prompting for that conversation. That was a spontaneous, that kid could never apologize. And this is where we bring it back to the topic of them challenging you. Put a kid in classical conversations where they learn to debate. They learn to debate, and he's going to win he won every debate because I just gave up. I was just like, I don't have time. I got to go to work at 6 a.m. I don't want to debate you. The fact is, these are the rules here, and this is what I expect.
Right?
End of discussion.
Oh my goodness.
But it was terrible. So he would always win because you just couldn't. You were like, okay, fine. Okay, fine. Yes.
I understand that.
Mm-hmm. Yep. Okay. That. Just for the sake of my idol of peace and comfort.
Yes.
These are my idols.
I relate completely. Yeah. My goodness.
So changing the total direction of his brain, and luckily he was like 19. Brain development, the massive amount of brain architectural change. It kind of ends at 25, so I had time to change the architecture of his brain. And so I was so thankful for the Lyme disease. It was like, I felt like, I can't say truly, that would almost be blasphemous to say, Corrie ten Boom, do you know who she is?
Yes.
And she writes The Hiding Place, and she talks about when they were in the concentration camp, they had an infestation of fleas, and really bad one. And she had smuggled a Bible in there, into her dorm, and the SS officers wouldn't come into the dorm because there were fleas. So they started to pray at the end of their Bible study, thank God for the fleas. You know what I mean? And I kind of consider it like my thank God for the fleas. It's thank God for Lyme disease, like the ability for my children to think clearly, for my son to have an ability to connect his mind, put his mind and body integrated back together, so maybe he has a chance to know who God is, because at the time, It did look demonic. I mean, there was like
That rage.
rage in his face,
Yeah.
it was terrible. And now his heart is softer. Now he's receptive. So, like, when we talk about the way God created us, created us mind, body, and spirit. He really did. And he doesn't fracture those things. We don't just take care of the body and not the soul. We don't just take care of the soul by reading our Bible and praying all the time and not take care of our bodies, because God values the whole created
Right.
being. When he resurrects us at the end of the days, he says he will call us out and we will be like him.
Right.
We will have a perfect body. That's what Paul says. We'll be perfect, have a perfect body, not like this one, but it's still going to be a body. So he
Mhm.
didn't throw the body away and say, we're going to be floaty spirits everywhere. you
Right.
know? So, I praise God for that. And I don't know. That's all I got to say about that.
Talk about picking yourself up by your bootstraps and just making it happen. I mean, that's what a mama does though, right? Like, you take what you can,
You
you
do
use what
it,
you can,
but you do
and
it
then
because you love
sure.
the
Yeah.
Lord, right? I mean, why do we parent diligently, teach them diligently? Isn't that a book? Why don't we why do we do that? Because we love God. And like, if he's chosen to
Mhm.
make these kids my parents. That's another thing, my Bible counselor that helped me deal with my son, because I was dealing with him in my flesh before I was going through Bible counseling. And now I had the gospel, but I didn't know what to do with it. And she's like, God chose that kid for you, and you for him. You with your imperfections, him with his, for his good and your glory, for your good and his glory. And so what is he teaching? Nothing will expose the idolatry of your heart than struggle and stress, and certainly a difficult child. I couldn't believe how much I wanted peace and comfort above God, above honoring God. Like, that idol needed to topple and it needed to be stomped on. But I just
Oof.
wanted that. I want comfort. I wanted to be peace. Just give me some peace.
Oh my goodness, nobody talks about that. I mean, nobody talks about how that really is an idol. I'm like feeling very convicted at the moment. Because we talk about like the love of money and the love of, riches and the love of like business and career and like all these things, but nobody
Material.
really, yeah, material stuff, but nobody really talks about the God, the idol of just being comfortable. I mean,
Anything that raises up against the knowledge of God,
right,
right?
right.
Anything that we want, and
More than
this is defined by, I can't remember whose book I read, if it was Tim Keller. He writes Counterfeit Gods.
hmm
And then there's another guy who, Bigley is the last name. I can't remember his first name, but Paul Bigley, Todd Bigley, something like that. He writes another book about idolatry, and I can't remember what it is. Both of them pastors, both of them telling their own story of identifying their idolatry.
right, right.
And Counterfeit Gods really goes through, like, giving you names,
Mhm.
and that was really helpful, because then I was like, I gotta repent of that.
Yeah.
Because really what he defined it as, and I use biblical sources, it's not like he's coming up on his own, is anything you love more than God at that moment, more than honoring and loving God and serving him and surrendering to him at that moment, that's idolatry. And so ministry can be idolatry.
Oh, absolutely. Yeah. My husband and I in the ministry for 30 years. Well, we saw that for sure. Yeah.
It can be good.
Anything can be picked up as an idol.
And if you raise your kids up as, like, the idol of your love, like, you wanted kids, you couldn't have kids, and now you have kids, and now you make them the object of your affection above God. They weren't designed to handle
That's a
the
pressure.
pressure.
Yeah.
God was, and so you will
Mhm.
crush them if you make
Absolutely.
them your idol. So idolatry is destructive in our hearts and minds, not only that it makes us worship the wrong thing, that's the big thing, is it makes us
Right.
worship incorrectly.
Yeah. We're always worshiping something. Yeah. Reminds us of something. Something that you talked earlier about was your passion about Christians being afraid of holistic medicine
Mhm.
and that fear and kind of almost like really as a church, which is fascinating. We are okay with conventional medicine. We run to our doctors. We're
Mhm.
taught to trust in the system, at least my generation was.
Mhm.
I think the younger generations since COVID are more questioning than the rest of us, but
Mhm.
um, there really is an idol of medicine
Mhm.
in our nation and
Mhm.
the Western world. So there there has been a fear, for Christians to even consider other modalities of healing. I mean, I know I've had conversations with people even about homeopathy. Oh,
Mhm,
that's voodoo. And I'm like, homeopathy is actually based in physics, quantum physics. There's
mhm,
no spiritual ties to it whatsoever. In
mhm,
fact, they're the ones who designed gold standard, I mean, double blind placebo studies.
mhm,
They're the ones who
mhm,
created that whole way of science.
mhm.
So it's just fascinating, the misconceptions and the ideas of different healing modalities that I don't know. I think it's I don't know. Talk to me about that, like that ignorance and Christians fearing it, and
I think there's
it's a
a
big
a
idea.
healthy skepticism that Christians can have, and they should have. I think that God is doing a work in this generation. I'm sure he does it in every generation, but he's raising up believers in a space that's been dominated by spiritual people.
Mm,
Holistic health in the 60s and 70s was not dominated by Christians. It was dominated by witches.
mhm.
So maybe there's a little bit of that leftover, like a holistic health. That's witchcraft because that's what it has kind of been, where the dominant voices were coming from prior to this generation. The science has evolved so much. There's so much better understanding now of like physics, quantum physics.
Mhm.
If you said quantum physics in the 80s, people were thinking you were spiritual because it was, astral projections and stuff like that. But just because they use that language doesn't mean that that language hasn't been co-opted. Like, there's a redemption happening in what has been predominantly kept in the dark from people. But I think Christians to have a healthy skepticism is good. I know plenty of people in my field that they're very spiritual and they ask their spirit guides to blah, 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 blah when they're working with clients. Run away from that. That's
Yeah.
not somebody you want to work with. And I think the hard thing is navigating, trying to find those people. Like, how do we find a holistic consultant who doesn't do that? And you don't want to spin your wheels, waste your time, spend your money a million
Right.
times. So I get that. But again, yeah, I think that we also tend to sometimes I heard one of the pastors that we didn't go to church very long after that. He was like, I don't care about it. During COVID, he's like, I don't care. That's not what we're about. We're about the eternal things. And I'm like, yes, but we live here and God placed us here.
Yeah.
We're not just to go like not care. What does God say about stewarding things? Like,
Well,
what is
even in the
stewardship
Lord's
about?
Prayer, on earth as it is in heaven, now, like
Mm-hmm.
it's now.
Mm-hmm. What I
Yeah.
teach my clients, because I want them to have eternal perspective as they're working with me, and I want to guard them from idolatry. Because when you feel like crap and all of a sudden you feel better, you can make a whole lot of idols about this new knowledge that you have. So I'm always like, this is what stewardship looks like, right? Put your hands up,
Yes.
open, wide. Okay. We do in faith. Like we act in faith. When we go to the doctor, you're acting in a whole lot of faith. And
Absolutely.
I guarantee you, because I was trained that way, I didn't know anything.
Mhm.
Okay. And when you're in it, you also have a hard time getting out of it because the system, at least in the US, I mean, other countries may be different. You're in so much debt. Like you can't afford to turn your blinker on and go in a totally different direction. You got to pay your bills. If a doctor goes out and he's $500,000 in debt, he's got to pay his bills. It's going to
Yeah.
take him 20 years to do that. He can't just give up medicine. And so he's going to kind of go, I'm going to do my prescriptions the way they tell me that is medicine is evidence-based medicine or because they just look, they're human. They got this practical
Responsibility.
responsibility. Yeah. And so, when we care for our bodies, it's really a stewardship. I'll tell you, there's a big movement in the Christian community about financial stewardship. What is this guy's name? What's the guy's name who
Dave
did?
Ramsey. Ray
Dave
Ramsey.
Ramsey. There you go.
Dave Ramsey,
Dave
yeah.
Ramsey, Financial Peace University, right? How many Christians went to that Sunday morning teaching about Financial Peace University?
Mhm.
Okay. What was he teaching you? He was teaching you to steward what doesn't belong to you. Your finances aren't yours, they're his. He gives them to you. He can take them away if he wants to. It's his. So he's teaching you to steward those things with an open hand, knowing that those resources are his ultimately to do with what he pleases. And you're submitting when you're good stewards of your finances and aren't frivolously spending them, and you're saving appropriately, you're not living in debt and these type of things. That's good stewardship of one resource, money.
One.
How about Health Peace University? Like, how
Right.
about how about we learned that stewarding our bodies has probably more weight. You got no debt and you have all the money in the bank, but you're 60 and you've got dementia. I have a friend who's 65 years old, rapidly cognitive decline.
You're useless to the kingdom of God on earth
Yeah,
if your
there's
health
that,
isn't there.
and there's just a real tragedy in that, right? You're
Absolutely.
gonna spend the money that you did save on assisted living and medications and living in oblivion until the day you die. So, right, no use to the kingdom. And so I would say stewardship of your body is just as important, if not more, than stewardship of your finances. It's all his
Mhm.
ultimately. And so when we take that perspective, that and we have to remind how forgetful are we? Do you know how many times God tells the Israelites,
My
like,
goodness.
I I am the God who brought you out of Egypt with my mighty hand. You know how many times he says that in the Old Testament and then again in the New Testament? I mean,
Oh my goodness.
Stephen tells that story again right before he's stoned to death by Paul or Paul's friends, right? Over and over, God says, by the way, I'm the God who brought you out of Egypt. Remember me?
That's right. Oh my
And
goodness.
he says it a lot because we're forgetful.
Absolutely.
And so I think the reminding our hearts that we're stewarding everything we do is with an open hand. We give it to God and we ask God to do with it what is right and good for our good and his glory. That's
Mhm.
the right attitude for health. And holistic health just means that you're using wisdom. You're not abdicating responsibility. Like, I feel like in medicine,
That's
that
true.
system is set up to abdicate you go to the doctor says you have this diagnosis, then he says you take this medication. There's no conversation, no back and forth, no really even time for questions to fully understand what's happening here. Do you know what I mean? The doctor's
So that
really
you
not
can take
trained.
full responsibility for your own health. That is a brilliant way of explaining holistic medicine and that, sorry, going
Mhm.
after, and you're abdicating your responsibility for yourself by just trusting and doing whatever a doctor tells you to do.
And
And
here's
they
the
don't even have all the
kicker.
information.
Here's the kicker. When you abdicate responsibility to another person for the outcome of your health, what if it goes bad? Do you think he has any skin in that game? He doesn't live with the outcomes of his direction for
Right.
your health, but you've given him 100% control. You get to live with the consequences. And do you know, like, the number one cause of death in the United States is prescription, like,
Medical
medical
malpractice.
malpractice. So it's foolishness to give up, like, just to say, I'll let the doctor deal with that, you know? I mean,
Yeah.
I ask his advice. I'm writing my book right now about anesthesia, and I say, but build your dream team. You're still the CEO of your health. Build your dream team. Have your holistic consultant. Ask them questions. Have your doctor ask him questions. They have different areas of
Perspectives.
wisdom and knowledge, and you get to take that in, and with the wisdom that God has given you, you don't have to have a PhD. You can go, okay, I think this is the best thing for me.
Absolutely.
Because ultimately you're going to live with the consequences. So take time. If you spend a lot of time trying to understand stocks and finances and investing and retirement, why are you not doing the same thing with your
With your
body?
body. Right. There's that brilliant quote going around recently that it's, a healthy person has a million dreams and a sick person only has one, and that is to be healthy. So
That's true.
it's a completely, yeah,
It's
different
true.
conversation. But I love how you said that about holistic health, and that is basically just taking responsibility for
Hmm.
your body and honoring that.
Right.
I've never heard that before. That's brilliant.
Yeah. Yeah. And so, right now I'm working on a book to teach people how to take some of that ownership of their health when it comes to anesthesia, because there's a lot of books about gut health, and you can probably become your own expert by reading. Pick up a book. Most people just do YouTube and podcasts these days, but try to pick up a book or an audible book. I can't tell you, I don't have time to sit and read all the time, but I'm always listening to a book because I'm always like, I didn't know that. Like, I didn't
Mhm.
know until I read this book last year that women have 1,100 more genes than men. Did you know that?
Yes, it's fascinating. And
That's
we're so different. We really are
100
different.
more genes, and most of which are involved in detoxification and hormone balance. So we're more complicated. And I actually
Much.
tell my patients that now when I see them in the hospital, for women, I'm like, you're more complicated. So we do a little bit of extra stuff for you on the anesthesia side because, your husband over here, he'd be fine. 'Cause you get to you got all this stuff going on. You got your hormones all, your perimenopausal, your this. So I kind of make them laugh. But
So is there really something that we do need to know when it comes to anesthesia? Honestly, someone who's gone in, I've never been told how to prep for it. I've never told I needed to detox from it. I mean, as a practitioner, I see the need for that now, but as just, a patient, I've never been told that there's a concern around it any way, shape, or form and how it
yeah,
affects the bodies. Like,
yeah,
what are some heads up that people should know about anesthesia?
yeah. And you don't feel bad. I worked in anesthesia and I knew there was you don't give old people too much general anesthesia because they can have some cognitive decline. That's all I knew. We were taught. So we were taught to alter the anesthetic for older patients when possible, if possible, to protect their cognitive function. So we were taught that. It's not new knowledge. But I never really asked a question about it. And here's the kicker. I work in anesthesia, right? So I'm with it all the time and I'm exposed to it passively all the time. So when I moved from Georgia to Colorado, in Georgia, I did a lot of pediatric anesthesia, which is a lot of that just kids don't let you start IVs. So it's not like I can give them propofol and go to sleep. I got to do the barbaric thing of slapping a mask on them, letting them cry themselves to sleep. I hated it because I'm like, this is not good. People should have been crying going to sleep. It's stressful to them, they're crying because the mommy's not there and they're confused and you're slapping a mask on them and they're making them go to sleep. But I'm taking this mask with gas blowing through the room, putting it on the patient. And
So you're even like everyone in the room's being exposed to that as well, not just the patient.
exactly.
Oh my goodness.
Yeah, and then when anesthetics are metabolized through the lungs, so when the patient wakes up, they're exhaling into my face. They're exhaling those gases. So there's a lot of past of exposure, and there's not really good studies on it. What we're told in the professional world is that we have OSHA that regulates parts per million of what's allowed. So before a certain part per million is not safe for exposure because it can lead to all these things, including miscarriages. So in fact, we know that's enough of a problem in pediatrics that when you're pregnant as an anesthesia provider, you usually step back from pediatrics for a while because the gas exposure is so high. Wow. So here I am cumulatively getting passive exposure daily, not thinking anything of it.
Well, you're pregnant too?
Yeah, I didn't know. Did, but I didn't. When I was pregnant, I did back away from the pediatrics, but still my point is that over a decade, I had all this passive exposure. When Stephen finished getting well, I had my own health crisis. Like, I finally was like, my brain ain't working right. And I had all this stuff I had to unpack. And on what part of it was all that cumulative anesthesia exposure that I wasn't working to clear. I wasn't actively dealing with detox on that side. Those gases are different than heavy metals. Like, you could do heavy metal detox.
So you wouldn't detox it the same way as like a parasite or a metal or...
Yeah. You can Google those kind of detoxes all day long, but Google anesthesia detox, see what you come up. Not much there because they're more complicated chemicals, but they have massive impacts on the brain. And so, there are certain categories of people that are kind of at a higher risk when it comes to anesthesia exposure and the impact on their brain and immune function, even because it also causes a suppression of your immune system in a significant way.
Right when you need your immune system to be like at its strongest if you're going into surgery of some kind to heal. Like, wow.
Mm-hmm. Yeah. Your mitochondria take a dive just from the anesthetic, not even from the stress of surgery. Now I had the stress of surgery. So just from the anesthetic, our mitochondria go in the cell danger response. Your white blood cells, they don't move right. They get kind of paralyzed. Your immune system stops firing properly and your magnesium stores get burned up. It's just a whole bunch of stuff that happens. So it's very stressful. I call it a necessary toxic event. So when you're preparing for something that's going to be a necessary toxic event, like let's just use flying on an airplane because that's what I use in my book. When you go to the airport, you're already anticipating, oh, this is going to be stressful on my immune system. I'm taking some extra vitamin C, right? Why? Well, you got EMF going in, you got radiation going through, you got recycled air. You get on an airplane that's an aluminum tube full of Wi-Fi. So it's just basically a Wi-Fi router across your head the whole time. That's like 540 feet with 180 passengers in it, all breathing recycled air. And then we go 36,000 feet in the air, where the oxygen tension is like, if you literally, if cabin loses pressure, you have 30 seconds. My dad's a pilot. That's what he says. You get 30 seconds.
30 seconds?
Yeah, they say a minute. You got 30 seconds if you're lucky, according to my father.
No wonder that's it's so stressful to fly on the body. I feel it every time I get on a plane. I feel the physical
Yeah. And so,
pain.
and then not to mention that it's stressful to getting through all that and the TSA and blah, 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 so stress, exposure, radiation, pilots and stewards have a higher rate of cancer because of the radiation exposure at altitude. So there's a whole bunch of stress of flying in an airplane, but it's a necessary exposure that people take all the time to usually take some precautions, usually prepare with some, I don't know, some extra stuff, right? How do I get sleep better, try to get my circadian rhythm right after I get there? People usually think about it. But they don't think about anesthesia, and anesthesia is more toxic than that. And so, it's a necessary toxic event. People get on an airplane all the time to fly across the family. Anesthesia is a necessary toxic event. If you need a life-saving operation, you need to have it. And praise God you can do it unconscious.
Exactly. I mean, exactly. My kids and I really like watching like historical videos and movies and stuff. And when you see people undergo surgery and here's a strap of leather to bite onto while we cut into you, I'm like, oh, I thank God for modern.
Thank God for, I call it probably the most valuable advancement in modern medicine, anesthesia. I say that knowing it's toxic, but 100 years ago, 150 years ago when anesthesia was started, we also didn't have a constant bombardment of EMFs everywhere. We also didn't have pesticides in every single food. We also didn't have pharmaceuticals in our well water. The bombardment of toxicity in our environment today is so high compared to a half, 150 years ago, that the impact was probably the impact in anesthesia then, because of the type of anesthetic, was more like you're going to die under anesthesia. Today, you're not going to die under anesthesia. After anesthesia, you were fine. Here today, it's more, you're not going to die under anesthesia, but you might not feel great for a while afterwards. And if you're older than 65, 10% have a risk of developing dementia within a year. 1 out of 10.
Is that okay? So I've heard a lot recently about the MTHFR gene mutation really playing a significant role in the methylation, process and detoxing from anesthesia. Is that something that you talk about in your book at all, as far as the difference between having that mutation and not having that mutation, and how to, act appropriately?
So I do talk about it because I had giving away too much of the book here, but I had a patient who had cancer, and she's the reason I'm writing the book, because it was her that made me go, should we be doing anesthesia a little differently? Because I had just written a blog on MTHFR, and I opened her chart in the hospital, and there's MTHFR listed in her diagnosis. And that's not something you see in a diagnosis in a medical chart typically. You'll see cancer, but you're not going to see a gene mutation. So I thought, that's weird. So I asked her about it. I said, hey, what's up with the gene mutation? She's like, oh, well, when I got cancer, they did genetic testing on me. They saw that I had that. And I said, did I tell you it's probably the cause of your cancer? And she said, yes, they said that. And for some reason, and I still haven't seen it.
Amazing.
I see cancer patients all the time. I hadn't seen that gene come up. So I thought it was maybe God ordained, that God's had me look at that, ask that question. Maybe he's prompting me to, I don't know. Who knows what God is doing? His ways are much bigger than mine. But it did make me go, because I'd just written the blog, and then I'm reading this, and then I'm talking to her, and I'm like, did you do okay with anesthesia before? And she's like, fine, I think. Okay.
You didn't know any different, right?
Now you got cancer. Now you have this gene mutation. Okay, well, now I have conflicts of interest here in my brain. Maybe I should do your anesthesia a little different. So I did. I altered her anesthetic a little bit to make me feel better. Not really her. She didn't know the difference. I was like, I'm going to feel better about this for you. Like that I do this because you're about to have chemo and cancer. All this stuff that's your toxic burden's
It's too much.
so high. At least I can maybe reduce it a little from the anesthetic side. Not that it matters the next time you have surgery, somebody else will give it to you. So whatever. But I just felt better about myself. But then I started the research, and I was like, what do I need to know about our gases here and our flow, our anesthetics? And it's not just the gases, it's all of it, but the gases are a big piece that make make it hard on your body. And so that led me to where I am writing the book. And I'm producing a product that's targeted detox for anesthesia.
Seriously?
So that's
Oh,
coming.
that's so exciting.
Yeah. So that'll be coming down the pipeline around the time the book comes available. I'm starting just for the detox product side, and then we'll work on some stuff that'll support the brain health along the way as well. Those are two separate things, but detox is important. That'll help support your immune system, take the burden off the immune system. That means
Yeah.
do a lot of work. So, but
When
MTHFR.
is your book coming out? So go ahead. MTHFR.
No, that's okay. I said a lot and didn't answer your question,
Yeah.
but MTHFR is just one of the many methylation genes that can be altered in a person. It's the one that gets a lot of press and the one that most people know, and they make fun of it. They call it the gene.
Uh-huh.
Gene. Yeah, I hear that a lot in
Oh, the
my
MNFR.
MNFR. MNFR. Yeah, but it's only one. And the thing that's interesting, your risk factors. There's risk factors for anesthesia where your risk for cognitive impairment or injury to your brain is higher. And those with MTHFR or methylation I go broader. I don't say MTHFR. I say methylation problems, which is 66% of the population, by the way.
Yeah, exactly. It's a large population.
2/3 of the population
Yeah.
has a methylation problem. So that means a lot of people need help. And
Yeah.
then, I would say the other category of people that really need help, you got anybody who's got neurodevelopmental problems. So these are the kids. The
Mm.
kids with ADHD, autism, my gosh, they already have these methylation. They got methylation problems. So, they're already in cell danger response. These kids are add another toxic burden to their system, and it's really not good. They have no resilience. ADHD, autism, then, oddly enough, women with hormone imbalance. So that could be anybody from 20 to 50 to 60 to 80. Okay. Hormonal imbalance means you're 20-year-old with PCOS, you're 40-year-old with perimenopause, and you're 60-year-old in menopause. All of those women are at risk because when your hormones are imbalanced, progesterone is one of the biggest hormones that supports detoxification.
Oh.
And so when you don't have a balance between estrogen and progesterone, you don't detox.
And with all of our country, like your progesterone is triggered by ovulation, an ovulatory event. And if you're on birth control, you're not ovulating, and therefore you have no progesterone, or your progesterone levels are sunk. So oh my goodness, I'm seeing a whole nother cascade of issues and events there. That's fascinating.
Yeah.
Okay, you've mentioned this word a couple times. I was hoping maybe you could just maybe define it. And what is cell danger response?
So sorry, talking to a practitioner, and I'm just making assumptions.
No, I love it. I absolutely love it. I'm just this past summer really been digging into that, and I would love to hear what what is. And
I recommend people go to my blog at beyondbrainhealth.com and
okay,
read Cell Danger Response 1 and 2 because I do go
yes, it's
into
a very good article. I read it.
Okay, good. So cell danger response is it's basically it's a theory, but I mean it explains very, very much. There's been research on the mitochondria for over 90 years, and in the 80s we had huge leaps forward, and now I would say in the last 15 years we had another huge leap forward in an understanding of what the mitochondria do. And the mitochondria, if we're homeschool moms listening, it's the powerhouse of the cell. That's what you're telling your kids, and it is. It makes ATP and energy. The biggest thing is it makes electrons. Electrons are quantum particles that your cell uses.
You're electric.
So the body is electric. Okay, it's electric. Start dancing. Cell danger response is when your mitochondria, whose primary job is energy production for the cell, get a voltage change signal that indicates that they need to do something else. So what the mitochondria are primarily is powerhouse of the cell. What they are secondarily are voltage meters. A classic example would be the flu. Okay, here's your happy little mitochondria in your brain and your heart and in your gut, just floating around, making energy. Everything's cruising along, and all of a sudden get the flu. And the mitochondria go, I just felt a change over the cell membrane, electrical potential change. That means electrons moving
Okay.
are being stolen in this situation. They're being stolen, being ripped away. There's a drop in the frequency. And those mitochondria go, danger, 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 Will Robinson.
Mhm.
I think the immune system's going to need a little help. So they go, peace out, liver cell, peace out, heart cell, peace out, brain cell. I got to come and help the immune system. Then we'll get over this major damage and I'll come back and we'll make healthier cells that are more resilient to this threat that just came across your system. And so they leave and they support the immune system's response. And as a result, you feel fatigue, like you got to go to bed. Boy, you can't work out, muscles hurt, right? Because you can't make any energy because the mitochondria aren't there because they went into the immune system, bloodstream to be part of the immune system and do this immune system response. Well, what happens if the threat doesn't resolve? What happens if there's a whole lot of toxins floating around the body and you just don't get rid of them? Well, the mitochondria are going, well, I still have a problem. I still got to give support to this immune system. Like, I'm sorry, cells, you got to figure it out on you. So you end up with a fraction of the mitochondrial density that you're supposed to have in the brain, in the heart, in the liver. And those mitochondria are acting as an immune response. And they don't ever go back into it because the danger hasn't resolved, toxicity, whatever it is. Now add the MTHFR gene into it. Now that means that you don't detox. That means you accumulate toxins. Now the liver is not getting any mitochondrial support.
Right. Which is your main detox organ. Yeah. Or
What
one
do
of
you
yours.
think happens to a developing brain if the mitochondrial density goes down? The neurons they're not replicating and creating a brain that's healthy. It's creating a brain in danger. That describes autism. So cell danger response is actually meant to be a hormesis response, meaning it's meant to make your body more resilient to a stressor. So exit, come back. I've got new information. We're going to make the cells differently and they're going to be more resilient. But when the threat doesn't go away, they don't ever finish that cycle and they stay in danger response.
Mode.
Cell danger, cell danger, cell danger. So that's cell danger response.
That's a great explanation. Thank you. It's fascinating to me. I've been reading, I can't remember the name of the book, but it's that book on earthing and grounding,
Mm-hmm.
and it's by like 3 different doctors. And
Mm-hmm.
then also sat in on several webinars this past summer with some, amazing doctors who study the electrical capacity of the cells, and just how
Mm-hmm.
it just blew my mind how a cell is really, like, they think is 30% nutrients, but 70% basically it's a battery. It's water and electrons.
Mm-hmm.
There's just so much more to it,
Oh yeah.
yeah, than what we think. It's
And that's why
fascinating.
grounding works. Because if you think of it, the fact that the mitochondria is exiting, the mitochondria is thinking a cell danger response. Well, what happens when we give electrical energy to the body? Well, that voltage changes
Yeah.
inside the body. There's a voltage shift. What is the mitochondria again? It's an energy producer. It's an immune responder. We didn't know that, right?
Mhm.
And it's a voltimeter. So you shift the electrical energy in your
Current.
body by earthing, grounding.
Mhm.
Energy flows in. The mitochondria go, oh,
Yeah,
hey,
chill.
wait a minute. So then we kind of support the mitochondria finishing the cycle of cell danger
Mhm.
response and making a healthy cell. So that's why it's powerful to bring earthing in
It's really, really
and
fascinating.
quantum particles in. However you can do that. What do quantum particles come from? Well, sunlight, fresh air, grounding. But then if you get real complex, you can bring them in through homeopathy. You can bring them in through quantum biofeedback, which is one thing I use. Believe it or not, a good quality essential oil. I mean, they were my gateway drugs, but they really are. A good quality essential oil is the essence of a plant. It's the expressed
Mhm.
essence of a plant. There's a lot of quantum particles in that, so it's a very powerful electrical
Sure.
tool if
Yeah.
it's real. Problem is today, in this market, try to find a clean, pure essential oil that's not garbage and synthetics.
It's really
So,
hard to do.
that's my warning for that.
I
But
know. There are lots of it's
and then
yeah.
supplements, if you can get supplements or whole food supplements, they end up if they're really good whole food supplements, they're going to end up delivering electrical energy to the cell rather than demanding energy to break things down. So that's why synthetic supplements are so bad. We're already like stressed beyond belief, and now we're taking Costco supplements because they're cheap. Well, good for you. Now you just ask your
You
body to
added
break
to
more
your
stuff down,
toxin burden.
expend more energy. So
Yeah, and eating
supplements,
whole foods is really powerful for the body because it's full of that life
frequency.
force and frequency in the
And we can
yeah.
take it a step further, growing your food and playing in the dirt. That all connects us back to the garden where God created us to be. And it gives us frequency there, gives us
Mhm.
grounding, it gets us a connection to our food, and believe me, food is different if you grow it. Not
Oh, yes.
necessarily because not just because the earth and the tending of the garden is better, it's because of the love you provide to it. There's a connection to your food. We, like, have put ourselves in these boxes. Medicine, food's over here, I'm just this box, and I kinda integrate, but reality is, like, we're holistic beings. We should be a part of stewarding all of it.
All of it.
That's the other thing that's, good stewardship of the earth. I mean, I'm not a whatever you call I'm not a PETA person,
Environmentalist or
environmentalist, that's idolatry.
yeah.
But we should be the first leading the charge in stewarding what God created. It's His creation.
Mhm.
We're the ones that should be speaking life into every aspect of our being. We shouldn't be, but with it properly, like not in an idolatrous way. Does that make sense? So
Absolutely.
anyway,
Absolutely. Wow. Okay, so when's your book coming out?
a great question. At the moment, like let's see, I'm chapter 9 of 12. So
Okay.
I should be coming out on release by the end of the year.
Mm.
I'm looking toward the end of the year as the launch date, if not the
Really?
first of January. Might be
So
first of January just for marketing purposes because everybody's gonna be busy with Christmas. But be a
yeah.
good Christmas present if I can get it out before then.
Pre-order.
You know.
A good January book club book maybe.
Exactly, exactly. But it's a book I'm writing for the average reader, not for the PhD. That book's coming after because I think that getting it in the hands of people who need to advocate for themselves is more important than convincing a bunch of, doctors, PhDs, all these people that the science is legitimate. There's not good research in this. When I go into the literature research for anesthesia. There's so many variables in trying to understand cognitive decline that occurs in a patient after anesthesia that authors never commit to it's an anesthesia problem because it's like,
Mhm.
well, it could be an inflammation problem from surgery. It could be a variable from the patient. And then those are all true things. But the problem is we understand if you're going to do that and you can't do the double blind placebo control study, what you can do is be a smart person and go, okay, let's look at the drug. What
Mhm.
is the components of these drugs? What do they do in nature? And what studies do we have on that? And that's what I did in the book, essentially. Like, okay, so yeah, you can't commit because there are all these variables. And if we're going to do an evidence-based medicine the way medicine does it, then yeah, okay, I see how you're being non-committal.
With
But
yeah.
we have the ability to think through things, right? We know mercury, what it does. Do we have double-blind placebo control studies on mercury? No, but we know it causes brain damage.
Yeah, we
you
know
know,
it does.
so, I mean,
Yeah.
that's the thing, so that's how I do it. I approach it. There is enough research when you look at the full spectrum of things, though, to make the statement that 1 out of 10 after 65 can develop dementia within a year, and 2 out of 10 if it's open heart surgery, so 20% going for open heart surgery can develop dementia in a year. And there's about a 10-point IQ change in children for up to 2 years after
That's
an exposure to
significant.
anesthesia. So, yes, your kid's trying to learn how to read and write, or your kid's studying for the SATs, you might wanna think about p postponing surgery or certainly prep and recovery the way I'm doing, way I'm gonna recommend in my book, because that's a well-known thing. That blew everybody's mind. I remember when that study came out, 15 years ago, and it was like, "Shh, we don't talk about that in pediatrics," 'cause all these pediatric anesthesia providers were like, "What do we don't know what to do with this. We know it does it, but what are we supposed to tell our patients?" Like, "So just don't tell the patients."
My
Not that
gosh.
not that
Talk
we're
about right to informed consent there. I mean,
well, the
well, then
problem is
because you
that
have
we
a
don't have a
liability issue.
solution.
Yeah.
And if your baby has a major hernia and it's throwing up and it's failing
It's
to
like the
thrive at 6
necessary
weeks
toxic
old,
event.
like, one of those pyloric stenosis or something like that, you're gonna take the anesthesia because 'cause they're gonna live. I mean, if a
Yeah.
baby's going in for surgery, there's probably a good reason they're going
Reason
in for
for it.
surgery, you know? I talked to a mom in our American Heritage Girls group, and she was like, her child was born, like, early and all these things and had to have multiple surgery, and she's like I'm like, "Don't" the child would be dead if you hadn't done surgery, so
Yeah.
I'd much rather have a child that has a little bit of a cognitive impairment that we can maybe work through because you got till 25,
Yeah, their brain's plastic.
yeah, than a child that's not with you. So don't take on you don't take on the unnecessary burden of, oh my gosh, I wish I had known, and now I failed as a mom. I've done that. It's not helpful.
Oh, yeah.
Okay,
Been there.
it's
Yes. I
not
still
helpful.
struggle with that in lots of ways.
But I think once you know, then you can do something. And like, if you have the option, like if there's a surgery that's necessary, but not necessary for life-saving immediately, and it can be postponed a little bit so that you can prepare and then you can recover,
Recover
then my
properly.
book will be right for that. The classic teenager who's studying for SATs and they're athletic because they're trying to get into Harvard or something, like they're playing all these sports and they're doing all these things and they get a joint injury and have to
Right.
have surgery multiple times, which is very common. Those kids get an impact on their brain. Don't let them take the SATs right after. Maybe you want to prep and recover them.
Wow. That's really good advice. Man, that's fascinating.
Yeah. I think
Man.
and then the last category I would say that's a risk, a unique risk in anesthesia is the 60, 65 plus with kidney stones.
Kidney
Very
stones.
specific group. And that's because kidney stone bacteria independently cause damage to the brain. And it blew my mind when I made this connection, because I was like, that anesthetic is like 20 minutes long in some cases. It's a very short anesthesia exposure. But I've seen enough clients in my practice that was their triggering event. And I've heard enough patients in the OR who said their parent had that as their triggering event that I'm like, it's a thing. So why is it a thing? So then I did a little research on that and had to go outside the literature and go, what is it about kidney stones? Well, we get these bacteria, three of the four literally have impacts on the brain by themselves. Even if you clear them, there's like the low grade infection that can cause like hippocampus shrinking, which is where your memory centers are. So kidney stones. So don't get a kidney stone. If there was an argument to do
Kidney
holistic health
stones.
to avoid kidney stones, this is it.
That's it.
Because
My
kidney
goodness.
stones are a big deal and seem
Kidney
very,
stones.
very benign, but it's not.
It's not benign. Yeah,
So,
I know that like I've known with some clients, some older clients, when they start struggling mentally, I immediately say you need to get checked for a urinary tract infection
mhm.
and with the bladder. So that's interesting that the kidney stones do the same
Yeah,
thing.
women are
Wow.
particularly unique, risk postmenopausal because our estrogens have declined, our brain shrinks as a result. So if you're not doing supportive measures for your hormones, at that point you have the added risk plus the hormones. Estradiol helps your brain, and the estriol helps your vaginal urinary tract health. And so the dryness and the things that happen postmenopausal to our urinary vaginal health make us at a higher risk for those infections. Then we already have brains that are damaged from the loss of our hormone impacts. So we're like, bam, 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 we get a double hit. 2/3 of dementia patients are women
Yeah.
because of that. So the hormone health is super important to consider, and that's why I'm extra. I wear silk gloves for my ladies in the OR if I can. I'm like, you get silk glove care for me because I know what
Oh,
you're going through. I am you.
get
But
it. We get it. We get it. Yes. Wow, this has just been fascinating.
I
I
know,
really can't wait for your book.
we're definitely creeping up on time. I hate I'm
Oh my,
sorry I talked so long,
no, you're
and I
good. I
hope that
love it.
everybody's hanging in there with me on everything.
I'm glued. I know I'm pretty sure other people will be too. But you also have a podcast and you have a blog and you have a clinic that you see patients one-on-one
Right.
in your books. And so I'll put the links to everything in the show notes so people can find you and
Yeah.
ask you questions if they have
Follow
more.
me on socials, Beyond Brain Health on Instagram, Dr. Sandy on TikTok, and
All
Beyond
the
Brain Health on Facebook.
all the
All
things.
the things. I have a YouTube channel, like I'm sure you do. So obviously you're recording on the video here. So it's
Yeah.
Dr. Sandy B PhD. Because I didn't want to make people again. I don't want to impersonate an MD. I'm not an MD. I'm a
But
PhD.
you're pretty smart, you know.
Yeah.
You can hold your own.
Uh,
That's for
I
sure.
can debate with the best of them.
I
Sometimes they
love
know
it.
a whole lot more than I do, and I'm like, I don't know. You're right. I don't know that. And that's the thing. The more you know, the more you don't know.
That is the truth. Oh my goodness. The more you learn, the more you're like, oh wow, this world is a lot more complicated than
But
we realize.
the more you worship the infinitude of God, our creator, right? Like the
Yeah.
more you know, The more you realize there's more to know, and the more you realize there's more to know, you realize it's an infinite knowledge. That's probably why, what is it? Who wrote Ecclesiastes? I forget. Solomon? Solomon, right?
Oh, Ecclesiastes was,
Yeah.
King Solomon. Yeah.
Yeah, so that's probably why he says to the accumulation of knowledge there is no end. Like he's like he went through drinking, he went through women, he went through money, he went through knowledge. He's just like, it's all dust. It's all
Meaningless,
worthless.
meaningless. Everything's
Meaningless. Everything
meaningless.
is meaningless. And what he's saying isn't it's meaningless. It's
Right.
just that it doesn't satisfy because Christ satisfies, because he's the infinite. He's the reason it's so complicated. We get a taste of the infinite complexity of his creation. When you start to study, I promise I'll end with this because this is a little deep and I might lose some people. But when there's an anesthesiologist out of Arizona his name's Stuart, and he went into anesthesia to study consciousness. Okay. He wanted to understand consciousness. And that's a big new age word, right? And he does want it out of a godless, he wants to understand consciousness without God, which most scientists do. But in his research, he's trying to understand, he's using anesthesia to understand how
That line and
does the anesthesia turn off consciousness? This is one thing that if you ask any anesthesiologist, you'll get 50 different answers, but most of them will settle with, we really don't know how they work, because we don't. Except that Stuart Hameroff has been studying it for over 50 years, and he has realized, and this is where he gets into the quantum science, the quantum physics of things. He has these very advanced devices where it measures frequency. When I put patients to sleep, I put a little device on their forehead and it measures hertz, okay? Cycles of rotations. It's the frequency of your brain. You have different brain waves at different depths of sleep, okay? So that's your global brain wave activity in hertz. He can measure picohertz, terahertz, because he's got devices that measure way down to the frequencies that are so tiny, because he's trying to understand where it is that the anesthetics are working. And it's not on the neuron itself. So most people, like, I just did a TikTok that went kind of crazy. A neuroscientist, very popular, Dr. Robert Love, he actually quoted a study that my student did when I trained. And I thought it was great that he did that. He was a really smart student. I was very happy that he was coming into anesthesia because he was a smart kid. I hate to call him a kid. He was an adult, but he was younger than me.
I
He
know,
was a kid, okay?
It's a kid. 30-year-olds are kids to me these days.
Yeah, right. So he said, well, anesthesia inhibits acetylcholine production, and that leads to anesthetics working, but also potentially the cognitive decline in anesthesia. That is a oversimplified explanation of how that works, but it is one part of it. It's a piece, okay? It doesn't talk about toxicity. You're never going to hear that in a medical circle because toxins is a holistic concept, okay? When I say toxins in the OR, they look at me like, seriously, Sandra? I'm like, forget it. I'm not even going there. Hameroff realized that no. What I'm seeing is that when anesthetics are exposed to the brain, it's at the terahertz that there's a frequency shift. And the terahertz are measuring something on the neuron that's called a microtubule. Where people might have heard the concept microtubule is back in 8th grade during mitosis. The cells separate and there's these little fingers that connect them and they connect them and then they become new cells. Those things are called microtubules. Okay. There's about 1 billion microtubules per neuron. And apparently their frequency is so great that their frequency is at a quantum level. So this connects you to, it makes you have the argument that, okay, consciousness is happening at a quantum level that is not physical. It is quantum. When we block it, that's what happens. We block the transmission of quantum frequency. And that is a scientist studying this. This is a medical doctor. And that has a lot of implications. That was way beyond this podcast. Of course, that in the world of consciousness, people are like, okay, the quantum reality, so we're a quantum universe. To me, it just answers the question. See, God is bigger, greater, and way more. Quantum physicists don't understand quantum physics, and I don't think they ever will, because it is far too complex. They come up with these theories that you'll see in the Marvel comics, like the many worlds theories, the string theories. They're all theories and that we can't ever test out. And I promise you it's because the Lord God controls everything. I always forget the name of the Presbyterian minister. I loved him. Friend of John MacArthur's, whatever his name was. I forget now. I didn't stop. But he actually said, and my favorite quote by him, he said, "There's not a rogue atom or molecule or electron in the universe. God controls them all. Sovereignty controls all of it." So, we'll leave with that. Anesthesia is complicated. Consciousness as well. But it's really because God gifts us consciousness, gifts us life. We have life as long as we have him giving it to us.
Can't help but be in a state of awe and wonder at all of it. It's amazing. That's
amazing.
what awesome is, right?
It is what awesome is.
True definition.
Awesome. Amen.
Well, thank you.
Yeah, well, thank you for having me on. I appreciate it. And like I said, if people have questions, find me on socials. I'll answer what I can. Look for the book. It's going to be
Can't wait.
I think a godsend for a lot of people. I'm glad I'm writing it because I feel like there's a big need for it.
Absolutely. Definitely. Thank you. Appreciate it. Okay. Thank you so much for listening today to Liberty Wellness. If you enjoyed our conversation, don't forget to hit like, subscribe, and share it with a friend who might need it too. Your comments and feedback mean the world to me, and they help me grow and bring you more inspiring stories and tools for healthy living. And just one more quick reminder before we wrap up, I'm not your doctor, and neither are my guests. Everything you hear on this podcast is for education and encouragement only. Please don't take it as medical advice. Your health is personal. So always check in with your own trusted healthcare practitioner before making any changes. So stay curious, stay inspired, and take good care of yourself.